Hey everyone, Matt Savage here. Today I'm joined by my good friend, physiotherapist, TPI Medical Free Professional, and the owner of Athletify, Scott Dunne. Scott, thanks for joining me.
Yeah, thanks, Matt.
So last week we talked about a mobility routine, and there are 3 moves that I want to talk about again today. So these moves were the pelvic tilt, which if you remember, looks somewhat like this. Also, we looked at our shoulder or thoracic rotation. So that's where I'm keeping my hips still and rotating my upper body. And then also looking at pelvis rotation when I keep my upper body still and move my lower body. These are 3 really tricky moves. So I'm going to show you how you need these for the golf swing. And Scott's going to talk a little bit more about how we can move our body properly. So in the golf swing, if we can't pelvic tilt properly, which is tucking basically our belt buckle down or up, we're not going to be able to transfer our power from the top of our swing to the bottom of our bodies. So at the top of our golf swing, you're going to see that my belt is on a line pointing downwards. This is going to happen on the way up. On the way down, we actually need to make that belt level out. So see how this gets a little flatter? That's the same motion of me doing this. If we can't tilt down in the golf swing, we're not going to be able to transfer our power from our upper body to our lower body. So Scott, do you want to show us a quick tip on how we can work on that mobility?
Yeah. So just as Matt was saying, we're going to focus on the pelvic tilt. The easiest way to start that, because Matt makes it look pretty easy, but it's actually not that easy, especially if you're new to the movement. So we take gravity out of the equation, and we lie like this, feet flat on the floor, and most of us will have a nice space in our lower back, which is totally normal. Okay, so this exercise is just about closing down that space in your lower back, okay? Whenever you do that, you do just what Matt was doing. You posterior tilt your pelvis, which is what you should be doing as you go from your downswing and into impact, okay? So this is me increasing the space of my lower back, and this is me closing it down. Okay, so increasing the space, decreasing the space, and this is what a dynamic pelvic tilt looks like. Okay, so what I would do is just do this maybe 20 or even 30 times in a row, and it's not a strengthening exercise per se, it's strictly mobility, training your body how to do this movement. Some people will be way better at this than others. If you find that you have decent movement, you can progress to this variation, which is getting a little bit more challenging against gravity. And we're going to do the pelvic tilt again. So if you can see my lower back, it's flatter than it was when I started. This is the starting position. Okay, now flattening the lower back just as if I was on the floor. Okay, so it's that same kind of thing. And then relaxing. Okay, so just keep your eyes on my belt line. And it's changing as I'm pelvic tilting. Okay? What we don't want to do is the classic cat-cow exercise, which is this. Okay, this is a great exercise. You can even add it to your program if you want, but it's not what we're working on. Okay, so keep your thoracic spine stable. So no upper back movement, all lower back and pelvis movement.
That's great, thanks Scott. So that would be your starting point to work on. If you can master the floor, move on to all 4, and then you can move into the exercise that I was showing you. The other thing that we talked about was that rotation. We want to make sure that our upper body and our lower body can disassociate or turn separately. If we can do this properly, we're going to be able to get to the top of our golf swing and start with our lower body, and in impact position, our hips will be further open than our shoulders. That's going to allow us to generate power and hit the ball consistently. If we can't move our body separately, we're going to see a golf swing that starts like this and stops when our hips and our shoulders are at the same point. From here, we tend to lift straight up, and you'll see from this angle, from here what I'll do, if I move my upper body and lower body together, I tend to come across over top of the ball, creating that dreaded slice that we see a lot of the time. So we want to be able to work these parts of our body separately, and Scott's going to show us a couple exercises that we can do to work on that.
Yeah. Okay, so the visual that I always tell people like an everyday example for this is to imagine your body like a washcloth that you're wringing out. Okay? One part of your body is going one way, the other part of your body is going the other. Okay, so I'm going to just lie down here and show you this exercise. So my shoulders are staying square to the ceiling, okay? And my lower body is rotating side to side, okay? And the range of motion is over if you find your shoulder is lifting up, okay? So if your shoulder has to leave the floor to achieve more range of motion in your lower body, don't worry about going any further. Make sure your shoulder stays down, and that's just your range of motion currently. The more you do, the more range of motion you will get, and you're going to start dissociating more. That dishcloth is going to be able to wring more and more water out. Okay, so that's the easier version. The more challenging version is this. So we're going to get into almost like a hip or quad muscle stretch, and you're going to focus on the buttons of my shirt. I just like putting my hands on my chest so I don't trick myself into cheating or anything like that. So hands stay on the buttons of the shirt, and you're going to rotate one way and rotate the other. So notice as I'm doing this, my pelvis is staying square to the camera, and my upper body is rotating. Okay? So you do that, I would say 15 or 20 times on this side, and you switch it up, and the same thing. Pelvis stays square, rotating one way, rotating to the other. And again, 15 to 20 times, and you should feel much more limber after that.
That's great. Thanks, Scott. We really appreciate these tips. Work away at this. Make sure you can master all of these moves. If you do have any issues mastering these moves, I highly recommend seeing a TPI medical professional. Scott's here at Athletify Newmarket. You can reach out to him. You can also reach out to me with any questions. Thanks again, Scott.
Thanks, Matt.